Okay, so I see a few people have joined. If you can just put in the chat that you can actually hear me and see the screen, that would be wonderful. And then I'm going to mute myself right after because I've got some background noise. I'm hoping the plumbing will have that because if it actually runs across here, all of a sudden we need barriers. Yay, awesome. Very good. So as we're going through, if you guys have any questions and answers, we're going to be, you can put them in the Q&A section, and then we're going to answer them all together at the end, just so we can keep the flow of the presentation. And if there's anything else, we can definitely put it in the chat as well. I'm going to mute myself for a few more minutes, and then we'll get started in just a little bit. Okay, everyone, I think we're just going to go ahead and get started. I wanted to thank you for taking time out of your schedule to be in attendance here at the MGMA webinar for August. Unfortunately, we can't be together in person. We are going to be doing virtual events between now and the end of the year. But I'm really excited about this presentation. It's definitely timely with everything going on and really fits in with a lot of what we're facing with trying to accommodate and still make life work with all of the pandemic and social distancing going on. So contactless options generate more revenue, more patient-owned revenue, and I'm excited that we have Adam Strupp, who's the Director of RCM and Digital Solutions from Professional Office Services. And Adam brings 15 years of experience working with consultants and healthcare practices across the country on implementing best practice strategies to collect patient-owed balances. And Adam brings innovative solutions to help engage patients in the practice through the revenue cycle process. So thank you very much, Adam, for taking time out of your schedule to be here with us today. And for the MGMA events going forward, we will just be keeping you updated with webinars that we are having and other partner organizations are having as well. So definitely keep track of all of the exciting and important information that we are sharing. So with that, I will mute myself and I will be handling the chat and Q&A towards the end. But Adam, I will let you take it away.
Thank you so much. Appreciate the intro. And yes, my name is Adam. I'm the Director of RCM and Digital Solutions at POS, Professional Office Services. And been doing this stuff a long time as far as statements go. And when I look at 2020, I think, man, we've come a long way, because back when I started in 2002, I had to convince offices that it was okay to allow their statements to be sent by a third party. And now we fast forward all the way to 2020, and we're talking about delivering statements by text message and email. And to be quite frank, not sending statements at all. I do want to give you guys a heads up. Of course, there wouldn't be a day in 2020 that wouldn't be perfect. We had a flood in our home, and there, of course, the people that can come fix the floor, they chose today. So if you hear any hammers going on, I think all the loud stuff's over, but I do want you to know that I'm working from home because of COVID. So it's just an ordinary day in 2020. Hopefully better days are to come. Today, we're going to talk about a few things. And by the way, I want you all to know that, when we start talking about contactless options, yes, at Professional Office Services, and of course, several other entities out there, we can accommodate the contactless stuff. But what I want you guys to not forget as I talk through this, that there are so many other ways and items that inside your office have to become contactless. Obviously, finances is just one little small piece of that, and we're going to talk more about that. Today, we're going to talk about the ability for patients to pay online. Okay, it should be happening today. If your office does not have a way for patients to pay online, one, you're doing your patients a disservice, but most importantly, you're doing your accounts receivable a even bigger problem, really. Because online payments, actually, our stats are showing they improve outstanding patient AR by 8%. People are always like, Adam, where the heck are you coming up with 8%? Why would it improve our AR by 8% if we offer online payments? Well, that's easy. Stats show that Americans now go to their mailbox twice a week, okay? And when they go to their mailbox is typically after 5 o'clock at night when they get home from work, or on the weekends. That means, or when is that time, I guess we should say? Typically, your offices aren't open at that time, right? So that means they're going to their mailbox when you're not there to take a payment. And if you don't have a way for a patient to pay, right then and there, we're too busy as a society. People won't pay their bill. And then what they'll do with it is they'll put it on the kitchen counter, or that's where ours goes at least, or on the refrigerator. And it sits there and they forget all about it. In fact, check this out. 31% of the patients that don't pay you on the first statement had the money to pay you in their HSA. They intended to pay you. They literally just forgot to pay you. 31%. They forgot to pay you. And those are obviously pre-COVID numbers, but we're talking about an HSA account. Companies are giving money to employees to pay their medical bills. Okay? We're also going to talk about card on file. Card on file, and I will tell you that if you talk to myself or my team or our sales reps, we will tell you that card on file is the way of the future. And we're going to get into card on file a little bit further down the road. But to be honest, if you're taking a new patient in today, or even a current patient, and when you schedule that appointment, I know this is going to sound crazy, and you're going to say, Adam, patients are going to look at us like we're nuts. But I think you should implement a financial policy that when you set up that appointment, you let them know that you'd like to get their credit card information, and that if after the visit they owe less than $50, you're going to automatically hit that card. And tell them, and I don't care if it's an excuse or the truth or not, but tell them that the reason is simple. You are in healthcare. You don't want to be passing around credit cards or money or any of that back and forth over the when they get there and they sign in for their appointment. Okay. Now we can go further and talk about the fact that I believe you should have intake forms online that are submittable, obviously secure with PHI on them. I believe you should have insurance card uploadability so that they can upload insurance cards. I want you guys to keep in mind that, again, this isn't all about finances. This is about making patients feel comfortable. We're going to talk more about that here in a minute. Text statements, email statements, okay? If all of these other things fail and we have to send them a statement, let's send them an electronic statement. Again, we talk about what electronic statements do, and I'm not going to lie to y'all. Contactless, that word was not in our presentations up until about 2 or 3 months ago, as you can imagine. And now you turn on the TV and every single commercial says, we have a contactless drive-through. We have a contactless this. Well, guess what? You can have contactless statements, and that should be no doubt. We'll talk more about those. And of course, the phone. When I say the phone, we can do outbound calls. You should be utilizing text messages and emails. All of that stuff is on a mobile phone. All right. So now let's build the beginning or the base of why we're talking about this today. And I'm not going to lie to you guys. I think that we're missing the mark in healthcare. Now, if you're on the phone, I'm going to say some of this stuff and you're going to go, Adam, we have that taken care of. I'm not talking to you. But I do want you to know that I'm talking to the offices, and I've talked to a lot of them. A lot of the offices that we're talking to are saying, this protocol that we've put into place during COVID, why do patients think this is so nuts? We've been doing this for 50 years, for 100 years. I mean, obviously technology's gotten better and we've done these things, and I get it. You might now be wearing a shield instead of just a mask when you're in your office. I get all of that. But honestly, when we look back, you guys have been dealing with the transmission of viruses and bugs for how long? And so you guys think, okay, this is simple. This is just the normal way of doing things. And yeah, COVID is super contagious. We know that. So we're taking extra parameters. All right. But the problem is if you're not communicating that to your patients, then you are going to have a ticked off patient and you're going to lose patients. And I'm going to give you an example, and you're going to hear me talk about my father-in-law a lot on this call. And the reason being is my father-in-law, which is a great man, but he is so scared of COVID. And guess what? He's not scared of COVID for himself. My mother-in-law has a form of arthritis that's obviously an autoimmune disorder, and he is scared to death of catching COVID or having her catch COVID because he knows that she is at high risk. All right? And I'm going to tell you, on my slides, you'll see 80% of Americans have concerns about infection exposure in a medical facility, and 33% of Americans will not go to a medical facility right now, okay? That is plain and simple. We know it. There's more stats to come on that. But I can tell you that my father-in-law, he had an angiogram scheduled for mid-April, okay? It had been scheduled for a long time. I don't know. I think he had a stress test. They thought there might be some blockages there. Obviously, March came. April got here, and he said, nope, not doing this. And he picked up the phone, and he called his cardiology office, and he said, I'm not coming in for my angiogram. My wife's got this, and I cannot catch COVID. And they said, sir, we are going to take precautions, and we've already implemented protocol. You're going to be tested for COVID, as are anybody that you're going to come into contact with, and you're going to be fine. And he goes, I still don't want to come. And they said, sir, you need to be here because guess what? We think there might be a blockage there. And if you don't come in, you could be risking your life. And we all know that, right? But he got to the office. He never received anything from them as far as wearing a mask. It did say it on the door. He got in. This is funny. He gets into the office because he listened to them because he kind of freaked him out and he believed what they said. But he got into the office and they said, sir, can you sign in? Guys, my father-in-law is paranoid. Okay? And what I'm trying to explain is that he is not alone. There are a lot of people that are paranoid. He told them, and I kid you not, he said, Adam, he goes, they had a whole jar of pens. They didn't have 2 jars. They had a whole jar, meaning They didn't have clean pens and dirty pens. By the way, guys, if you think this is silly, that's okay. I have had people burst out laughing when I talk about how there are a ton of Americans that are going to the mailbox with gloves on and putting it in their garage, and they sit it in their garage for 7 days so COVID dies off of it. I've literally been on presentations and had people burst out laughing and say, are you kidding me? Okay? I'm telling you this not because it's silly or you may think it's silly, but because this is how people are thinking. He told them, my father-in-law, he went and signed in, they asked him to sign in, and he said, I'd like you to sign in for me. My hand has been injured. He told him his hand had been injured. He's scared to death, okay? Now, I'm going to tell you, my father-in-law right now, he did go through the angiogram. Thank God. No blockages, no stents, nothing. He's looking for a new cardiologist, okay? They lost a patient because the protocol that they put into place, one, was not communicated to him, and two, he did not feel safe. And that is a problem because we are taking for granted that people or patients believe that they're scared, and we're taking for granted the fact that we've been doing this for years and we know the protocol in place, and we think everybody just should trust the system. Well, unfortunately, we all know there has been so much misinformation spread over the course of the last 4 and 5 months by several different people, whether it comes out of Washington, D.C., or obviously right here locally in our states and in our cities, that people aren't trusting anything right now. And we have to know that, right? So look at on this screen, 87% of respondents said the pandemic caused changes, delays, or disruption to their healthcare. Now, I'm not going to sit here and read you all of these stats, okay? But what's scary is 44% of those reported delays in active treatment for cancer. Okay, come on. We know what cancer does. We know how deadly it is, right? We cannot have delays in care on that. Now, look at the second one. Routine screening has plummeted, running less than 90%. And then, of course, you can look at the bottom one. Less than 50% of infants and children are caught up to their vaccines, okay? Guys, I saw a stat, and I think you probably felt it in your offices, but I saw a stat that in the months of March, April, and May, we had 15,000 less cancer diagnoses in this country than normal. Folks, you know it as well as I do. COVID did not cure cancer. And every single one of those patients that walks into your office or is too scared to walk into your office that could be diagnosed during a screening with cancer, if they've refused to go to the doctor, they are going to be left with less options tomorrow than if they would have gone to the doctor today. And then we can start talking about, and I don't really want to shine a big light on it because we know that COVID has killed hundreds of thousands of people now. Okay, it is a serious virus. Nobody should obviously take it lightly, especially with the way that how contagious it is. But we all also know that now we're up to this stat is changing every single day. It's a moving target. How many more people have died of stuff that has nothing to do with COVID because we're literally too scared to go to the doctor? I'm preaching to the choir, I know, but this is so important that somebody actually says, hey, wake up. There are people out there, and we're not doing a good job of communicating that you have to go to the doctor for all of this stuff. Now, we get to the part that's my part, okay? I get it. We're in financial, we're in AR, we're in RCM, okay? So this is where this leads us to. 37% of patients are going to delay care if they're not offered an interest-free payment plan. I want you guys to know that's pre-COVID numbers. I'm guessing that number goes up to 60% because we have unemployed. Every single day, more and more people are becoming unemployed. You can see the third one here. We lost 8.7 million jobs during the Great Recession. Remember that? 2007, 2000 to 2010. We're losing that every 10 days right now. So if you think somebody's going to walk into your office with a high deductible insurance plan or no insurance at all, and they need a test done and that they're going to pay you if they're unemployed, you better think again. So you're going to have to think ahead, and we're going to have to come up with systems and plans to put in place so that we can make sure we have a fighting chance to collect that money. Because you know what, and I think some of you would say, Adam, it's our duty. In fact, I know a lot of doctors that say it's my duty to treat anybody. I get that. I'm not disagreeing with that at all. But guess what, folks? If you can't turn your lights on in the morning, you can't help anybody. So I feel like our front office staff, they don't hear that enough. They don't hear that we need you to ask for money, not because you're mean or not because we're hungry for money, but because it pays to turn the lights on in this practice. And the second we can't do that, we stop helping people. So forget about all of that. You can let patients think that all they want. But if you ever have a patient say, all you guys care about is money, no, all I care about is patient health. And the only way I can help you with your health is if I turn the lights on. All right, so you're like, Adam, what you told us all of the doom and gloom. What can we do? Well, we kind of talked about this. And there's the one thing I don't like about this slide. I bet you guys can't guess what it is. We are sharing a card, right? What if COVID's on that card? I'm just kidding. But they're sharing their credit card. This is not a healthcare office. This is a hotel. I used to travel back in those pre-COVID days, traveled a lot. I'd walk up to the front desk. I was so prepared. I had my license. I had my credit card, and I'd set it there, and I'd see how quick I could check out. It is a requirement for me to give a credit card or a debit card to the person checking me in at the hotel. It's a requirement. It's not negotiable. I can't walk into the Hampton Inn and say, oh, I don't have a credit card. Okay? We forget that. It's not negotiable. Now you're going to say, Adam, that's the hotel industry. It's not healthcare. That's fine. But do understand that thankfully we have industries like the hotel industry that's leading the way on this stuff. What else? Do you know you can't rent a car without a credit card? And I'm not kidding. I've seen literally people that get caught in an airport for weather, and I have no idea, because that's how we get our points and our miles and everything. No idea that people don't have credit cards. But there's people out there that don't have credit cards. I've seen them try to get a rental car without a credit card. It is not allowed. It is 100% not allowed. They will not let you give them cash. They'll say, well, how much are you going to pre-authorize my card for? $200. So can I give you $200 cash? No, you cannot. You have to give me a credit card, because if there's damage or there's something else, it's coming back on your credit card. And this $200 doesn't do us anything, okay? I'm just trying to explain that, again, industries are already moving this way. I'm going to explain how our industry can move this way, and we can dip our toes in the water without going crazy and without making patients lose their mind. I'll explain that in a little while. All right, the healthcare industry. This is so true. What happens, right? You all know it. Patient comes into your office. Patient leaves your office. We get insurance. Half the time it's a high deductible plan, so we don't collect anything, especially in the first, 6-7 months of the year. All right. Then the statement's sent to the patient after insurance is adjudicated. And of course, insurance gives you the runaround. And so by the time the patient gets it, they're all healthy. And it's 3 months down the road. They're all healthy. What did they do for me? I'm fine now. What am I worried about paying this bill? All right. This is what patients think. Okay. In healthcare, I don't know where we went wrong, and maybe it is, and I'm sure you all could tell me 1,000,001 excuses as to how you are unable to verify insurance, which, by the way, we have partners, and there are several places, check-in solutions out there. For example, Health iPass. They can do a really good job of estimating insurance and what they're going to pay and what the patient's going to owe. There's other competitors of theirs out there. Go look for them. Figure that out. You want to hear something crazy, and you all know it. So let's take, for example, dental office. I know, you're all healthcare. This is the MGMA. Let's talk about a dental office. Anybody been to the dental office lately? I just had my daughter. She went in twice for treatment because she drinks those sugary Dutch Brothers drinks all the time. She's in college. And she said, I told her, this is the last time I'm paying for teeth. And it was a lot of money. But you know what? I knew almost to the nickel how much I was going to owe when I left that. When she was in there, she got her treatment plan, and we walked out of the office. I almost knew to a nickel how much she was going to pay. Am I asking you all to know how much to the nickel? No, I'm not. But I am saying to you that when she sat down in that chair and the hygienist looked at her teeth, and then the doctor, the dentist came in the room and looked at her teeth and said, we have 12 cavities and we need all of these filled. They explained to us what insurance pays. They explained to us the maximum amount that insurance would pay, which is $2,000 per year. And then, get this, they explained to us that you will put a card on file. They don't care if it's an HSA card, a debit card, a credit card, or an FSA card. But they said before you go in for this next appointment, where we're going to charge you $400 one week and $300 the next week, they said, you're going to put this card on file. And here's what's going to happen when it's done. What we've estimated, we're going to charge you for it. That's with you in the office, Adam. And they did, and I signed off on it. And then they said, also, sometimes insurance is wrong and we estimate it incorrectly. And usually it's by maybe 10 or 15 bucks. And I swear, the same dental office, they always tell me this, fluoride's never covered with my kids and it's always $15. I know this. And they said, we're not going to send you a patient statement. And I said, oh, you're not? And they said, no, we don't waste money on paper statements. We're going to charge your card. Now, Adam, if for some reason there's a problem with insurance, and let's say the balance ends up coming back as $200, we're not going to charge your card, only if it's under $50. And I went, oh, okay, cool. Here's my card. I know you guys are rolling your eyes. Patients will never do that. No, this dental office, it's thriving. We were like 4 months out trying to get wisdom teeth scheduled and all of this other stuff. 4 months. It was crazy. They're literally telling people you have to pay. Believe me, if you set a precedent with your front office staff and you tell them we need to turn the lights on and this is the way it goes, it'll work, okay? I'll have other examples of that, all right? So let's talk about what doesn't happen. I just did, right? Patient does not receive estimates like they do in a dental office. Patient does not understand their insurance coverage. And statements do not adequately explain charges and insurance payments. In fact, 57%, hey, raise your hand out there if you guys have somebody that called you this week and said, I thought insurance was going to cover that. I mean, seriously. We work with patients every single day who think that this is 1980 and that they're going to pay their $15 copay and they're going to walk out of the office and they're going to owe nothing. There are still 57% of respondents that say they thought it was going to be covered by insurance, okay? All right, you can put your hand down. I know all of you are raising your hands, and I said this week, right? So what do we do about it? Well, Americans, you guys all know this. You probably fit into one of those categories. I'm sure I fit into one of them. 50% of Americans live paycheck to paycheck. 20% don't save anything. 66% struggle to pay a $1,000 emergency bill. How often do we plan on having a medical problem? Okay, I know it happens. Whether it's maybe we're going to get a hip replaced and we say, okay, I'm going to plan for this, or do you really plan on having a blockage in your heart where you or testing where they say, hey, we did this stress test, you need to do an angiogram now. I don't really plan on that. 66% struggle to pay a $1,000 emergency bill. 43% spend more money than they make in a month. Not shocking. Okay. All right. So what do we offer? Let's offer payment arrangements. Let's be proactive. Again, we are in a perfect time for the world to shift in healthcare. Okay. Yeah, it stinks. COVID's terrible. I don't ever want to have to live through this again. I hope we take the necessary precautions that it never happens again. But while it's happening, let's embrace some of this. Let's use it as excuses, okay? Explanations. Maybe that's a better way to say it. Patient calls, they set up their appointment. Hey, patient, by the way, We're collecting money when we come in. In fact, I'd love to get your card now so we don't have to exchange that card, because we want to take care of you when you're in the office, and we don't want to share germs with your credit card and your wallet and all the money that's in your wallet. Oh, by the way, yeah, you're welcome, because we care about you. Remember my father-in-law? If he would have heard that, my father-in-law is retired and he's done well in his life, okay? If you told him that about the money, he would love you to death. He would say, really, I'm going to give you my HSA card right now, or my credit card, or my bank account, or whatever, because he loves to hear that you don't want to transmit germs to him, okay? And he loves to hear that you're doing this with all the patients. You would be shocked at how many patients truly believe this, okay? You would be shocked that there's more patients that care about their health than they do about giving you a credit card. I know. I hear every single day, Adam, that won't work for us. That's not our demographic. You know what? Use COVID as an excuse. I hate to say it. Use it as an excuse. Tell them, here's what we're going to do. And then when they say, well, how much are you going to charge on my card? And you go, well, we don't know how much it's going to be, but we're going to talk to you when you get here. Okay, well, all right. Can we make decisions then? Yeah, of course. And if it's going to be too much for you to pay in one lump sum, then we're going to set up payment arrangements. And here's how our sliding scale works. If the balance is under $300, sir, we'll allow you to pay over 2 months. If it's between $300 and $500, we'll allow you to pay over 6 months. And if it's above $500, we'll give you 12 months. I don't care what you guys do. You can make that shorter. You can say that's too long. That's fine. But hey, we have a plan, right? It's better than what you got now. Okay? Also, financial counselors, way at the end of this list. Yeah, you guys probably roll your eyes. I'm guessing in orthopedic, you meet with a financial consultant and they talk to you about this stuff. Every time I've gone to a family practice, never, ever had anybody say, hey, by the way, this is how finances work, and you have a high deductible insurance plan and you have no copay. Or just so you know, it's around $125, Adam, for a visit. This is the way it's going to be. That doesn't happen. That doesn't happen when you go to urgent care. It doesn't happen when you go to the OB-GYN. Just took my daughter to the dermatologist. She's going to have Accutane done for her acne. And I mean, I can't make this up. Here I am giving a webinar on how in the world we talk to patients about money and contactless options. And we got in there. We talked about Accutane. For those of you who are familiar with Accutane, you have to have a pregnancy test once, and then you have 30 days later, you have to take another pregnancy test because of birth defects that Accutane causes. You also have to have blood work done every single month, okay? All of these items add up, and I don't even want to know what they cost. But for my daughter, I'd do anything for her, right? And the acne gets you down, and so you got to do something about it. Guys, I left that practice. You know how much they told me they were going to charge me for all of that? Yeah, that's right. They didn't say one thing about money. What if I was unemployed? I mean, what? I'm just going to go have her take the medicine in 30 days, do all of this testing, and then just write it off, send me to collections? There is no plan there. I was shocked. Okay. Went to my family practice recently. Walked in there. I'm not gonna lie to you guys. So we do fun stuff here at POS. We wanna find out how offices send statements. They'll send out a first statement, and then my family practice sends out about 3-4 statements. They all look alike. They put some little silly dunning message on it that nobody reads. And so I knew I owed this bill. What I'm saying is I let them keep sending it to me until they finally say, hey, you better pay it or we'll send you to collections, which, by the way, my office has never done that, and I've taken four statements. I have $3,000 in my HSA, by the way, so I can pay the $78 that I own. So I go into the office and I'm like, okay, I'm getting ready to pay my bill because I knew I was going in for my annual physical anyway. So I have my HSA card ready, and I walk in and they say, okay, have a seat, Mr. Strupp. We're gonna be with you just here in a second. And then they called me back to the room, and I went to the room, and then I had my physical, and then I left, and I said, okay. So I stopped at the front desk. What do I need to do? Oh, you're good. I said, I'm good. I said, you're good. I walked out. I'm thinking to myself on the way to my car, I owed you $78 and you didn't collect my money. Why'd you ever let me, one, see the doctor when I owed $78, let alone walk out the door without $78? Now I owe you $150. Probably not. The physical is covered, but you get what I'm saying. We are crazy. We're crazy in healthcare, and we expect to keep our lights on. Man. All right, so how do we do this? Educate your staff. First and foremost, every single staff member needs to understand the importance of money and why it helps everybody, including the patients. They have to have scripting. They have to be trained to say, this is not a negotiation. You're coming in here. In order for us to keep our lights on, we need to collect from you. Okay? I probably get sick of my stories, but I moved to Colorado. That's where I'm from right now. And I moved to Colorado 2 years ago, and my buddy was, his brother was our family practice that we went to. And my buddy was the office manager. The very first time, and this is in Arizona, that's why I told you that. Very first time I walked into the office, I can't remember, it was a physical or, no, I think it was something. It had to do with my shoulder. I just having pain or whatnot. And we walked in the office and they said, Adam, here's the intake form, fill this out. And by the way, you're going to owe $99 today because you have a high deductible insurance plan. I said, oh yeah, I do. Okay, cool. $99, that's weird. I said, why $99? I'm thinking to myself. I didn't ask the question. I just gave it to him, paid my bill, walked, was seen, left. I called my buddy later in the day. I go, I'm inquisitive. I said, we do patient financials and RCM and all of that stuff. And I said, Matt, I go, tell me why you collected $99 from me. Cause I go, I think, is that the cash pay amount? I said, I have a high deductible plan, but I feel like it's always like $120 when I go just get seen. And Matt goes, oh, that is a plan we have. And I said, oh, a plan? Tell me about this, because I haven't heard of a healthcare entity that actually has a plan, a family practice, in a long time. So tell me about your plan. He goes, well, what we've done is we've looked at the statistics. We've read in detail that patients are willing to pay up to triple digits without even skipping a beat. But the second you hit triple digits, which is obviously $100, they get reluctant and go, oh, I don't know if I have that. Or are you sure you have to collect that today? But he goes, you can sit in my waiting room. And every single time we ask for $99, almost 99% of every single patient says, here's my card, here's my check, here's my cash. I go, okay, cool, that's interesting. I said, so you waste a lot of money sending statements. He goes, I don't care. That's fine. It is a waste of money to send statements. I'm going to send you a $26 statement and you're going to pay it. And I said, I'm going to pay it? He goes, yeah. He goes, I'll tell you. It's a 50-50 coin flip on whether you actually pay your bill or not, but I collected $99 from you. Oh, and by the way, we found that when the bill is under $50, the statement, you'll pay it. Yeah, you may call it a coin flip, but you'll pay it. He goes, but what I can tell you is definite is that if I send you a bill for the full amount and don't collect money up front for $126, you have odds less than 50% of paying that balance. He said, when we made this switch, we saw a reduction of hundreds of thousands of dollars in our AR, sorry, not HR. But those are the plans. Those are the scripts that you really, really start talking to your employees about. And you explain, and I just will say it till I'm blue in the face. If you can't turn your lights on in the practice, then you can't help people. So stop letting people go in and use free services, okay? Now, obviously you're like, Adam, we're talking about contactless statements here. I feel like I have to build this base for some of this stuff. Notify your patients of these options. Call them contactless. They love it. There's commercials out there. They must have done studies, right, that say everybody wants contactless now, including my father-in-law. All right? Run contests. Tell them, hey, we're running a contest. We're trying to be contactless. We're trying to be germ-free for your safety. But at the same time we're running this contest, we want to get a credit card on file. And after the visit, if the balance is less than $50, we're just going to automatically run your card so that you're not getting a paper statement from us, even though we all know that they come from all paper statements pretty much come from clearinghouses now. Just tell them that they come from the office and you don't want to spread germs. Patients will appreciate it. Tell them they'll win an iPad if they put their card on file. Also incentivize your staff on trying to collect all of this data, whether it's a text, a consent for text statements or a consent for email statements or a consent to charge their card. All right. Then when a patient says, hey, I'm not going to be able to pay you, Because now you listen to Adam Strupp on this webinar and you said, we got to have a better plan to explain to high deductible patients that they're going to owe $550 when this is all said and done. $545 on my screen. So when they say, I can't pay that, what do you guys do? You crawl into a hole and you go, I don't know what to tell this patient. Have a plan, right? We would much rather help patients. One, that's our job in this life. Unfortunately, maybe you like it, maybe you don't, but that's what we signed up for. We want to help people. I think that probably every doctor in America would say, that's what I'm doing. You guys roll your eyes and say, there's probably a few out there that don't care. But if you want to help somebody and they tell you they don't have money to pay you, then you better have a plan. So you're going to set up payment arrangements. And guess what? These are contactless payment arrangements, right? You already, heck, you could even verbally take their credit card. You don't even have to hand it to them. Of course, you could swipe it if you wanted. But then you need to store that card on file. Now, each and every day I get on the phone and I talk about payment plans and payment arrangements and how they're contactless and they're great options. And everybody always tells me, well, at least probably 50% or more will say, yeah, we do that. They do one of two things. They either collect the credit card and they don't securely store it. They put it on an Excel spreadsheet. If you're one of those people, just know you are setting yourself up for fraud. And you don't want that to happen because people will track back where that card got used from. All right. I have probably, I would say this is over 50%. I would say 40%, maybe greater, will tell me, Adam, we don't collect a card at all. And I'll say, you what? You set up payment arrangements and you don't collect a card at all? Oh yeah, they just mail in their payment, which one isn't contactless, or they call us, which two is a waste of time for your staff. I want you guys to think about something for a second for payment plans. Payment plans are interesting because if you have a patient that says, they raise their hand and they say, I can't pay you $545. Do you think those patients are really the ones that you should be trusting to send in their check every month or call in a payment? If you're doing that, stop calling them payment arrangements or payment plans. Call them payment plans. You're praying that a patient who raised their hand and said, I'm broke, isn't going to be broker next month and broke-est the following month, right? But those broke patients usually have a credit card. So if you say my system requires that I place a card on file and we automatically charge that card, did you hear what I said with that? My system requires it. Why did I say that? Because language and scripting is vitally important. When you tell somebody that your system requires it, you are literally telling them that you have no bearing on what you can and can't do. You literally said they have to give it to you. Now, you're going to have 9%, and that's it, 9% of patients that are going to tell you, I don't have a credit card. Well, first off, you can laugh at them. And second off, just know that, by the way, you can let those 9% do what they're going to do, set up a payment plan or payment arrangements. But long story short is that those 9%, they just had their poker hand and they put it down on the table and they said, here's my poker hand. I'm showing you I got nothing in my hand. I'm not going to pay this bill. Okay? Most everybody wants to stay current with their healthcare provider because they know something could go wrong tomorrow and they want to be able to call you with no hassle. So 91% of people will dig deep into their wallet. Now, if you don't say my system requires it, what'll happen? They'll go, okay, see you around. I'll call you next month. Call you next month. How many people conveniently forget to call you? What are you guys currently doing to promote a contactless environment? How are you communicating with patients? We got to go back to this because this is what this is all about, right? But I still have to get on my soapbox and tell you, I don't care about the financial part. We can contactless that all the way to the bank, okay? But I need you guys to know that you need to use other methods, other pieces of what happens in the office, and they all have to become contactless because I'm going to go back to my father-in-law. If you all will communicate to your patients by email or by text and say, hey, for your appointment, here's what's going to happen. And we want you to sit in the parking lot and call us to check in. And then when we tell you it's okay to come in, you need to have a mask on. And when you get into the office, we want you to take 1 squirt of our hand sanitizer and put it on your hands. I'm not even kidding. My massage therapist makes me every single time I go to a massage, okay? There might be other protocol in your practice that you have to adhere to. Don't hide that protocol. Why am I saying that? I'm going to reiterate it. Don't hide it, because there's people like my father-in-law that if you explain to him that you're doing this, he will smile and he will love you because he knows you're taking the precautions. You may say, Adam, we're already taking those precautions. But if you don't tell my father-in-law, he doesn't know. And he doesn't know that everybody's getting the same email sent to them or text. Well, here's something cool. We have an orthopedic office in Arizona, huge orthopedic office. They were sending text appointment reminders with us. Those text appointment reminders to the tune of 20,000 of them a month. COVID happened. They shut down. They opened back up. For every single patient today, they send a series or sequence of 4 text messages. And the reason why I'm saying that is that it's 640 characters long. Okay? Each text message can be up to 160 characters. Multiply that by 4, 640 text characters. Okay? Folks, I want you to know it costs this entity 4 times the amount that they were paying POS prior to COVID. A lot of money, right? 20,000 up to 80,000 text messages. 20,000 up to 80,000 text messages. I know most of you guys have a system. Add that up in your mind, how much money that is that they're spending every single month. Crazy, huh? Guess what? Every single nickel they spend on those text messages is 150% worth it. Because there are people like my father-in-law that if you don't send those 4 text messages and explain all of the protocol and all of the precautions you're taking for them, they will not come in and have that hip replaced. They will not come in and have that knee replaced. 1 patient is all it would take, and it would pay for 1 year, probably greater, worth of those contactless text reminders that went from 1 to 4. They don't care, because they know there is my father-in-law out there that will refuse to have his surgery done because they aren't explaining the precautions they're taking. Think about that in every single aspect, every single day. Okay? Very quickly, text statements, text reminders, text gap in care notifications, recall. All of these things are contactless options. And what's beautiful is 98% of text messages are read within 9 seconds. They're responded to within 90 seconds. You want to hear something awesome on the AR side? What we came here for today? Out of every single text statement we sent last month at POS for offices, 50% of them were paid within 48 hours. Folks, if you can get a statement, a paper statement in somebody's hand in 48 hours, I'll applaud you. You'll have your money probably in 72 hours, okay? The mail isn't even delivered in 72 hours, okay? So think about that stuff. I hate to say it. Again, I keep on going back to it. With COVID, there's some silver lining here. We can use some excuses. You know what, POS? We have changed systems and processes during COVID. We had to adapt and evolve. And you know what? There's some things we're not going back on. I mean, heck, in our plant where we have 200 people, we're doing safety precautions that we never, ever have had to do in our lives. And you know what our president and CEO has said? We're not going back to the old way. Why were we doing this before? I mean, I'm not saying that maybe, in 3 years we should all be wearing masks. Heck, maybe we should. But during flu season, There's some stuff where, gosh, we went to crowded areas and we had no idea the impact of some of this stuff. Use COVID as a way to better your office. Again, excuse, explanation, whatever you want to call it. We did some gap in care text messages for some entities during COVID. And I'm going to tell you what we found. We did text notifications, gap in care reports, I mentioned that before, or just patient recall. You would not believe how many patients out there don't realize that telehealth actually exists. I don't know that we all like it, and maybe it's something that you guys want to shy away from, but I will tell you that we sent out for every 1,000 texts saying, hey, you're due for a visit, and we can do this visit because we went by appointment types. We can do this visit and conduct this visit with telehealth. We had 5% respond immediately. Oh, by the way, we would say, would you like somebody to call you back? And when they said yes, we had 5% respond yes. I think I have a slide later that does the math for me. I'll show you guys that here in a minute. But I'm telling you, contactless options are 100% the way to go. All right. So kind of went through all of this, and we're coming up on time here. But all of these different things happen. Just notice this too, and I'm going to fly through some of this because I elaborated earlier. For card on file and auto pay, text statements, put that card on file, automatically charge it. You know, the other thing you can do, and I always separate this, card on file is different than auto pay, folks. If you are uncomfortable saying to a patient, hey, we're going to automatically charge your card, get a system in place that can take and store a card securely, PCI compliant, HIPAA compliant, all of that. And tell the patient that when insurance is adjudicated, you'll call them. Now, I don't like calls because one, everybody sends you to voicemail, 85% at least, and then only 65% check their voicemail. But I don't mind a phone call if you do it this way. I have this card on file, and I'm going to call you after the appointment to run the card. If the patient says, will you call me before you run the card? If not, just try to get them to automatically have it paid. But then you call and you leave on the voicemail, hey, give me a call back by the end of the day, or I'll just charge your card in the morning. So, you know, worst that can happen is they decline the charge on their credit card company, which doesn't happen in healthcare very often, but it does happen. They can do that, but they still owe that bill. So it's not like a retail store where you walk out with, you walk out with marshmallows and you dispute the charge and then you get your money back. You know, it's just healthcare is different because you're going to follow them around. They're going to come back. You know who they are. You have ID on them. I mean, all of that stuff. It's just different. Okay. And then if you can't get them to opt in for those auto pay or just the card on file, send them a text or an email statement. And then we get to this part about driving utilization. Here was the point where 5% responded yes. So I know that we had for a few offices, we had over 150 telehealth visits scheduled, just like this one on the screen. If you guys are still doing telehealth and it's something that you're like, hey, it's probably one way to get the people that are Adam's father-in-law out to see us, then let us know, or let your messaging vendor know, your notification vendor, and just say, hey, can you do these for us? You guys, it'll keep your staff busy too, especially if you have still smaller patient or lower patient volume. You know, again, I don't want to bombard you guys with stuff to do, but if you do this, you get a report that says this person responded yes, you can just call them. Now, I will tell you that an office said, well, Adam, can't we just put our phone number on there and have them call us? And I said, yeah, but, and by the way, this is in March and April. I don't want to sound too lazy, but I said, there's a lot of people sitting at home right now. They're watching Netflix. And you send them a text, they don't want to stop watching Tiger King, right? To call you. But they'll respond yes, because 98% of text messages are read within 9 seconds, and and what was it? And then 90% of them are responded to, I think, within 90 seconds. I can't remember the exact percentage, but a lot of them are responded to. They'll respond to you. They just won't call you. So put it back in your office's hands to make that telephone call. Okay. Use your patient statements. You know, we're a patient statement vendor. So this is all stuff that we do, customize those, add something at the bottom. You know, we talked about the unemployment rate, and you're going to have to offer payment arrangements. Hey, make yourself a PR announcement here. Hey, we're here to help. We want to help you. We want to help you with your health, and then we're going to help you with the finances. So we're going to work with you. Just call us, okay? We can do all of these things through patient statements. You can also do them through patient inserts. This is a great way to communicate to patients. Maybe you saw that haven't paid their bill yet from a couple of months ago, and hey, this is what's new with COVID, and these are the precautions we're taking today. Again, all of these things, I don't like it because it goes through the mail, and whether we think it's silly or not, people think that the mail might have COVID on it. So I don't like it, but this is a way you can obviously, you know, after the 7 days and COVID dies, this is a way that you can get that information to them. Okay. Use signage in your office. Signage is a really good thing right now because obviously you don't want to hand stuff out. People don't want to take anything. So you can just have, we call them repositionable pieces that you can put up and explain the right way to wear a mask. You know, all of this different stuff. Again, it's all about perception. And we may say to ourselves, we've been doing this for 100 years. All right, so be it. But my father-in-law needs to know what you're doing and what you've been doing for 100 years, okay? So obviously the key takeaways here is that patients are delaying care. There's a lot of patients with that are unemployed that are needing financial hardship. They're needing options. So give them financial tools, give your staff financial tools to help those patients, and then communicate. So we're up against time. I will go back to our questions if somebody wants to read those to me, if we have any.
Okay, sorry about that. I had to get myself off of mute. It looks like we don't have many questions as of right now. I definitely learned quite a bit. Thank you very much for all of the information you shared. Is there anything that you would like to share in closing? Anything else that you can think of?
No, you know, I guess I would just encourage people, you can look me up on LinkedIn. I want everybody to know that if you have questions, and this is not a sales pitch, this is, if you have questions, message me on LinkedIn. Let's connect, let's talk. And if you just need ideas for your office, we are here to help. I am here to help. And it won't be a sales pitch for POS. There is a lot of stuff that we don't even do that I can say, this is what we've learned over the last 120 days. You know, as the director of this division, Larissa, it's just, I've had to educate myself on all of this stuff in the recent days because it's changing and the data continues to change as we move forward. So fortunately, I feel like healthcare is on the right track. It's going to be a while before we get all the way back. But other than that, I thank everybody for listening, and I'm good. So thank you so much for having us.
Well, I want to thank everyone that joined us, and this has been recorded, so we're going to be able to share that with the rest of our membership as well. But thank you very much for your time, Adam, and from POS as well, really just helping throw this little bit last minute webinar together. So you guys are great, and it's really awesome to have you as part of the St. Louis MGMA. So cool. I will end the webinar, and have a great day, everyone. Okay, bye.